A very warm welcome to everyone. I'm Elera, the founder of Maxeve Health. Our mission is to be your most trusted navigator for women on their fertility and life planning journeys, providing more clarity, support, and access to the global expertise. Today is my absolute privilege to invite Dr. Maryam Rahbar. Dr. Rahbar is not only an Oxford-educated scientist with a PhD in women's and reproductive health and a master's in the clinical embryology. She is also a certified embryologist, the scientific doctor at Nahal Fertility Clinic, and the founder of OvoLife. Most importantly, she is someone who can translate the complexities of science into actionable advice. Welcome, Dr. Rahbar.
Thank you so much for having me, Elera. I'm delighted to be part of this conversation.
I'm just curious, how has living at this intersection, being both as a mother and as a scientist, shape your today's perspectives? What do you learn as a mother that you couldn't have learned at the lab?
Sure. That's a really meaningful question. For me, the intersection of science and motherhood has been incredibly humbling. I spent years studying conception and reproductive health at the cellular level, observing embryos, optimizing lab conditions, and focusing on the technical precision required to help others conceive. But becoming a mother gave me a completely different lens. So in the lab, we try to control as much as we can: temperatures, timing, protocols. But in life, conception and pregnancy are anything but predictable. So when I went through my own journey of becoming a mother, especially while finishing my PhD, I realized that just how intertwined science and emotion truly are. So I experienced firsthand what it feels like to have to wait, to have to hope, to wonder what's happening inside your own body, all the things that our patients feel and go through every day that we often observe from a distance. So motherhood taught me something I could have never learned in the lab, that reproductive science isn't just about cells and embryos. It's about resilience, it's about vulnerability, and a deep human desire to create life. It reminded me that every embryo that we handle in the lab represents someone's greatest hope, and that understanding has profoundly changed the way that I approach my work today.
Yeah, it seems that experience was the big part of fuel for founding OvoLife. What was the specific moment or realization where you thought, I need to build this?
Sure. So the experience of going through motherhood really was the catalyst of that. And the idea of OvoLife came from a mix of science, personal reflection, and the many conversations that I've had with women over the years. So I kept noticing the same thing, that most women only start learning about their fertility when they're already facing challenges, and by then their options are quite limited. Even though I've spent my career immersed in reproductive science, I realized how little accessible, empathetic information there was out there for women, especially when it comes to egg freezing. Most of what existed out there felt either overly clinical or fear-based, and there was no safe, judgment-free space to simply learn about fertility preservation as part of understanding your own body. So the moment I knew I had to build OvoLife came after a friend asked me, am I too late to think about freezing my eggs? And I realized that if highly educated, capable women still feel confused and ashamed to ask these questions, the system is definitely failing them. And so OvoLife was born from that gap, to bring science and empathy together, to make fertility education approachable, inclusive, and empowering, and to help women make informed choices about their future without having fear or worrying about stigmas.
That insights connects directly to what some men and women we work with at Maxeve are experiencing. Men and women feel overwhelmed at the very beginning, especially when they hear AMH, AFC. Those numbers could cause instant panics. So let's demystify this today. If you were sitting down along with a very close friend who just got the test results and was very worried, how would you explain to her what does it mean and what it doesn't mean?
Yeah, of course. It's a really important question, and honestly, I get this all the time. So, if I was sitting with a friend who just got her AMH results and was worried about it, the first thing I'd say is take a deep breath. This number doesn't necessarily define your fertility. So, AMH or anti-Mullerian hormone is simply a marker of how many eggs you might have left. So, it helps us understand your ovarian reserve, but it doesn't predict whether you'll be able to get pregnant or not able to get pregnant. So I've seen women with low AMH conceive naturally, and others who have high AMH still face challenges. So it's kind of a piece of the puzzle, but it's not the full picture. So I'd explain that these numbers are mostly useful for planning. So they help you and your doctor decide things like whether egg freezing might be time sensitive or how you might respond to fertility medication, but they're not a verdict of your fertility future. And most of all, I'd remind her that her reproductive story isn't necessarily written by her lab results. Science gives us information, but it doesn't really capture the incredible variability and resilience of the human body. So these numbers should be used to empower us with knowledge, not to scare us. And it's just the starting point when you start doing ovarian reserve testing.
I love that. It's more like the starting point of planning, not the final verdict of destiny. Many people feel lost when they see low numbers. They quickly assume it's game over. But it's the most dangerous misconceptions, just like you emphasized. It shouldn't translate to no chance. It should translate to we need to be more strategic. Probably it means more targeted interventions, or your timeline is more critical compared to the woman with high numbers, but it shouldn't be despair. Dr. Rahbar, you have guided hundreds of women through this process. Is there any story that comes to your mind of someone who moved from fears about numbers to feeling empowered and back in control?
Yes, there's a lot of stories, but there's one that really stays with me. So I once spoke with a woman who was in her mid-30s who had just received her AMH results, and she felt completely defeated. One of the first things she said to me was that I feel like I failed a test that I didn't even know I was taking. And that line really stuck with me because it captured how isolating fertility information can feel when it's not explained in a human way. So we spent time talking about what the results actually represent and what they don't. So I helped her understand the science, that this was, again, a piece of information that she could use to make informed choices, and it was not a verdict about her future. Over time, I saw her perspective shift. So she started exploring her options more proactively, not because someone told her what to do, but because she finally understood what was happening with her own body, rather than just being given a number. And then she later told me that she was having clarity and that it gave her peace of mind and a sense of control that she hadn't necessarily felt before. So for me, that experience reinforced why we do what we do, to kind of bridge the gap between scientific knowledge and emotional understanding so that women can feel empowered rather than overwhelmed by this kind of information, because it can be quite daunting to receive a number and be told your ovarian reserve is low, without having understood what that actually means.
Thank you for sharing that story. It's really encouraging. The idea of buying time is central to the egg freezing. It's often misunderstood as the insurance policy. You have said it before. It buys time, not the guarantee. Could you elaborate on that crucial distinction?
Sure. I think there's a really important distinction to be made there. So egg freezing is often described as an insurance policy, but that's not really accurate. So it's more like pressing pause on your egg's biological clock. So when you freeze your eggs, you're preserving them at the age and quality that they were when they were frozen, which is incredibly valuable as egg quality and number naturally declines over time. What it doesn't do, however, is that it doesn't stop time on everything else. So the uterus, the body, the overall health continue to age. So while frozen eggs can improve your chances later, it will not guarantee a future pregnancy and a future baby because there's still so many factors involved. There's other factors like sperm quality, uterine health, and the entire complexity of embryo development and implantation on its own. So I always tell people that egg freezing buys you time, but it doesn't buy you certainty. It's kind of a way to keep doors open, to create an option for the future, but it's not a promise of a baby. And if anybody is telling you that, they're misleading you. So you have to set realistic expectations to kind of help make these decisions from an empowered and informed place, rather than it just be driven by pressure or false assurances from other people.
It's that honesty about limitations of egg freezing that allows us for more realistic planning, not the false hope. Right now, I want to talk about something more emotional heavy. What if the plan fails? IVF not working? For women facing repeated implantation failures, that's truly devastating. How would you support women through this anxiety and grief of their journeys?
Sure. I think this is a really important topic that doesn't necessarily get talked about enough. Fertility treatments, whether egg freezing, IVF, they can be incredibly emotional, especially when things don't go as you had planned or hoped. So behind every cycle, there's time, energy, and heart invested. So when it doesn't work, it's not just a medical setback, it kind of feels like a deep personal loss. And what I've learned through both my work and my own experiences is that emotional support is not optional, it's essential, and it has to be included. So we try to really take a holistic approach. That means creating space for women to express what they're feeling without judgment, connecting them with mental health professionals if needed who specialize in fertility, and kind of encouraging self-compassion at every stage. It's a really difficult journey to go through. We all understand that, and you have to be kind to yourself for going through it. A big part of that support is helping women understand that their outcome doesn't necessarily define them, and that if they're struggling, it doesn't mean that they failed. Most people struggle when they go through something like this. The process is really complex, and there's only so much any one person can control or take. So we focus on reframing the experience from one that's focused on isolation and shame to one that's focused on resilience, learning, and continued hope. And we believe that mindset matters so much in this space. So when women feel like they're seen, they're heard, and they're emotionally supported, it changes how they actually move through their treatments. And it brings a sense of agency and strength, even though the whole process can be really uncertain. So mental health is a big part of it, and we try to support women as much as we can to kind of try and ease the process a little bit.
The holistic view is everything. At Maxeve, we also work with many women from China who often face the tremendous social stress combined with the legal restrictions. From your experience, what themes have you observed among Chinese women exploring the fertility cross-border solutions?
Sure. So the situation for women in China is quite unique, and it really highlights how deeply fertility choices are shaped by our culture and policy. So in China, single women aren't legally allowed to freeze their eggs, and many of them are put in an incredibly difficult position of having to travel abroad to access the service. What strikes me is the women's proactivity and courage to do this. So these women are incredibly informed, they're determined, and they're quite intentional with what they want. They're not just thinking about egg freezing as a medical procedure, they're viewing it as an act of self-determination. So many of them are balancing family expectations, societal pressures, and professional goals, all while trying to plan for their future fertility in a system that doesn't necessarily support them. So in my conversations, a common theme is the desire for autonomy. So to be able to make decisions about their own bodies and timelines without stigma. There's also a deep need for trustworthy science-based information in their own language and cultural context, which can be difficult to access. And I have a lot of respect for these women because they're navigating complex circumstances, and it kind of sets as a reminder that fertility preservation isn't just a medical topic. It's about equality, it's about access, and it's about the right to make choices about one's own future. So platforms like Maxeve can be greatly helpful here because they can link patients to the information that they want in a way that's understandable for them. So I think there's a great need for something like this here.
Yeah. For women in our audience, considering cross-border solutions, what is your first piece of advice you would give them?
Oh, sure. So that's a really good question because taking that first step can be quite overwhelming, especially when you're looking at options across borders. The first piece of advice I'd give is to start with education. So before choosing a clinic or a destination, take the time to understand the basics of whether it's egg freezing or IVF, what that process involves, what outcomes realistically would look like, and what factors matter most for you personally. So things like age, time, and budget. Next, I would recommend focusing on credibility and transparency. It's really valuable to speak directly, if you can, to the medical and embryology team, not just the coordinators, to understand their approach and to ensure that you feel comfortable with the care that you'll receive. And finally, I would say don't underestimate the emotional logistics of it. So traveling abroad for fertility means being away from your support system, navigating a new healthcare culture, and sometimes facing language barriers. So having a trusted point of contact can make a huge difference in feeling supported and informed throughout the journey. The main thing I want women to remember is that this process is as much about empowerment as it is about planning. So take the time to do your research, ask your questions, and advocate for yourself, because that's the best investment that you can make at the beginning of this long and complex journey.
Thank you for sharing this perspective. As we wrap up, if you could give one piece of actionable advice, no matter they are 28 just consider about their futures, or they are 38 looking for options more actively, what would that be?
Sure. So if I could leave women with one piece of advice, it would be to get informed early. So whether you're 28 or you're 38, understanding your fertility isn't about pressure, it's just about feeling empowered. So I would recommend booking that first consultation. Even if you're not ready to take action, it's good to ask your questions, learn what your numbers mean, and understand what your options are, because knowledge truly is power in this phase, and it turns uncertainty into clarity and helps you make choices that align with your life, and not just fear or external timelines. So I want people to know that fertility planning isn't just about racing the clock, it's about kind of owning your own timeline. So the earlier you start that conversation, the more choices you'll have and the more confident you'll feel about whatever path you choose to take. So I think that's really the heart of it. Education first and always feeling empowered.
That's a perfect note to end on today. I do believe as well, knowledge is the ultimate source for confidence. Dr. Rahbar, thank you so much for today's all of the valuable perspectives. It's very helpful. It indeed provides our audience with more clarity and confidence for their future's planning. Your blended scientific rigor and deep empathy is exactly what this field needs. I also want to thank you for everyone watching. Thank you for your time, your courage, your investing in your future. We see you, we hear you. We're here to support you. Thank you.